Hello, everyone, and welcome to today's webinar, Evidence, Insights, and Strategy, Developing Effective Health Messages About Alcohol and Sexual Consent. My name is Orlando, and I will be your host for today. I am a part of the graduate assistants from IHEC. I am assisting Madison, the Assistant Director of the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and I am very excited to be hosting today's event. Before I hand over the microphone, I have a few housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you new to using GoToWebinar, you will see the control panel on the right of your screen. This is where you will find the question box that you can type and submit to at the end of the presentation. All attendees will be muted for today's program, but that doesn't mean you can't participate. Please type your questions in the question box in the control panel. This will allow us to see your questions and we will address them. So without any further ado, I'd like to introduce today's speaker, Dr. Michael Mackert. Are you there, doctor? I think you have your microphone on mute.
Can you hear me okay now?
Yes.
Okay, all right. For whatever reason, the other one wasn't working. So sorry about that. But I only was on the agenda slide, so no big deal. So what I want to share today is kind of three main items. And the first is just as a little bit of context, sort of defining health communication the way we do in our center, just to kind of get us all on the same page. The second thing I'm going to do is offer a few sort of the techniques and approaches we use to develop more effective health messages. And the third item is sort of a case study of health communication that we've done that is relevant for kind of the work you all are doing, thinking about how do we communicate more effectively and help students communicate more effectively about the intersection of alcohol and sexual consent. So when I give talks and start talking about health communication, people usually think one of two things. And either they come to a talk from more the medical side, and their healthcare providers maybe, and then the tendency is to think of it as, patient-provider communication. Or they come at it from more of a public health angle, and then it's, thinking of, this is your brain on drugs, and, ads on TV and kind of the more public-facing big mass media campaigns. And so I always talk about kind of defining health communication the way our center thinks about it, which is that it's both the science and the art of using communication to advance the health and well-being of people and populations. And the part I always take the time to highlight there is the science piece, because a lot of folks tend to think of communication as sort of a soft, squishy skill. And either you're good at it or you're not. And if you're a healthcare provider, maybe you learn from a really good mentor how to talk to patients. But the work of our center is really focused on that there's a best way to break bad news, and we can train you in it. You can get better at it. And I have a colleague who that's what she works on. And so trying to really focus on sort of the evidence base of health communication to help people, everything from sure patient provider communication, but how do families communicate about health? How are people talking about health on social media, all the way up to mass media campaigns. So sort of any level at which communication can happen, we generally have faculty doing work to kind of study communication in those contexts as it relates to health. And so our center is, as far as we know, the only center for health communication in the country that is actually jointly shared between a college of communication and a medical school. And we think of our work in three big buckets. And one is research, and we certainly have faculty and graduate students who are doing research on different issues related to health communication. We're doing a lot of education work, and so we have a minor that's available to every undergrad at UT Austin and a portfolio for graduate students. We also do a summer leadership event that's sort of aimed at mid-career professionals, particularly in public health. And so we have folks from the CDC and state health departments and universities and nonprofits and insurance companies and hospital systems who come together to learn best practices in health communication and also leadership. And so we do that every summer. And then also the most visible piece of our work, which you'll get to see some today, is related to practice. And so I often tell people outside the university that we operate like a very highly qualified health ad agency that's hiding at UT, because we have a team of 4 graphic designers and a copywriter and a web developer who are surrounded by programmatic staff with a lot of MPHs and folks with general communication training. And then we do funded projects with, Texas Department of State Health Services, MD Anderson, the University of Texas System, which is what I'll show you today, to really develop and implement evidence-based health comm campaigns that can really kind of live and work in the real world to help people lead healthier lives. So that's sort of, when I'm talking about health comm, what I'm talking about, and a little bit of background about our center just as context. So in terms of one of the goals of a webinar or a talk like this is always trying to give folks, a couple tools that you can use immediately in your work and take back, this afternoon and start thinking about things and tools you can use. And so a lot of this really comes from a shift in my own perspective. When I was in graduate school, I did telemedicine research. And so the first project I ever worked on was kind of a video phone-based telehospice program, helping people have better end-of-life care through telemedicine. And I really fell in love with health communication, but a lot of the work that I was doing was kind of more from a health education framework in a lot of ways. And so when I took the job here in the School of Advertising, it was a real shift for me because I'd never really thought about advertising. I was a telemedicine and health literacy researcher. And so one of the first things I did was I started digging into prescription drug ads. And there's a lot of reasons that they maybe aren't the best. Some things they do that are positive. The system probably could work a whole lot better. But one of the really common critiques of drug ads is they use emotional appeals to sort of create a patient or encourage a patient to go ask for a particular drug from their provider. And I mean, that can definitely have a negative impact on patient-provider communication. But if you think about that a little bit differently, a 30-second TV ad or a 1-minute TV ad created enough engagement with your health that you actually had a conversation with your provider about it. And that's pretty exciting. And in a different context, no one has ever, I don't think, yelled at the Truth Initiative for using emotional appeals to engage young people to not start smoking. And so a lot of the work that kind of the way I think about my own work and the research that I've done and the projects we do is, how do we take those tools and techniques and approaches of commercial advertising and persuasion that work and put them in service of public health? There's a 4-step process we use. If I'm teaching my advertising students how to sell anything, these are the 4 steps I teach them to work through. And it's the kind of thing we do in all of our health communication work. And so the first step is always research. And in the context of developing a health comm campaign, that's going to be a lot of things that I'm sure are very familiar to you all. So, what does the literature tell us about a particular health issue? And, what kind of secondary data do we have? And, interviews and focus groups and surveys and all those kinds of things. We also, in every project, take the time to do an environmental scan. How have other people tried to solve this issue? We don't feel a need to reinvent the wheel from scratch. If we can find someone else who's done a really good job that we can build on or adopt, we always want to do that, and we can. But the end of that is often just this big pile of data and information. And it's really hard to build an effective communication campaign on a big pile of data. And so the second step there is insight. And so how do we go from everything we've now learned from our research down to 3 or 4 or 5 really important insights into what's helping shape people's decisions on a particular issue and health behavior that we could build a communication campaign that could make a difference. And so it's that process of whittling down lots and lots of information down to a much smaller handful where we think communication can move the needle. The third step is strategy and messaging. So who are we talking to and what do we want to say to them? And then fourth and finally, we get to tactics. What is that message going to look like in social media, on a digital board on campus, on a radio ad, and a TV ad, whatever the kind of the right media options are? It's often fun to that's one of the really fun parts of a project and one of the most creative pieces to it And so it's hard sometimes to fight the urge to rush all the way there right away. But if you don't do those first three steps kind of in order to really have a good message, it's hard to then have a really consistent set of tactics and a cohesive campaign that can really help promote behavior change. A thing we end up thinking about and talking about a lot is how you frame your problem. You're all on this webinar because you do work in public health, and think about the particular issues that your work focuses on a lot, and in ways that people in the general public probably don't think about nearly as much as you do. And so in people working in kind of who come from the health side into health communication, sometimes I think we almost want people and our audience to make the decision for the right health reason without recognizing there might be other ways of promoting that behavior. And so if you think of the, promoting stairs on a college campus and getting people out of elevators and into stairways, not even counting COVID, but thinking of it as more just like more physical activity. One way of doing that is the thing that probably is running on some of your campuses right now, which are efforts to promote kind of the health benefits of taking the stairs. And so these were materials we built actually for a research project to study different appeals that could help get people out of elevators into stairways. We ran this probably 6-7 years ago now. And we built this because it's a really common approach. And so it's, it's the health benefits of using the stairs. But there's a lot of other reasons if you think about why people might want to get out of an elevator and take the stairs. It's the fact that it can be faster. In Texas in the summer, elevators are not the most pleasant experience with people who are sweating on their cell phones and talking, on phone calls, and just it's not very few people enjoy an elevator ride. And so we actually tested these two different appeals, and the ads on the right work better to get people into stairways. And it also works better if the signs are like 100 feet before the elevator and not directly in front of the elevator. Because once a person has stopped in front of the elevator, it's very hard to get them to move. So it's about sort of the right message in the right moment to help them make that decision, in this case, to take the stairs. And so thinking of the problem isn't how do we help people take the stairs for their health? The problem is how do we find the things that might keep people not wanting to be in an elevator, and put those messages in front of people gets you to an answer that actually gets more people taking the stairs. The next thing I'll share is a tool that we use called a persona. And it always feels a little corny and high schoolish when I'm teaching my advertising students to use these, but it's a thing that ad agencies very much use and that we use in all of our communication campaigns. And so in my traditional advertising classes, I work with the on-campus public health office to pick different health issues that the advertising students will work on, because it's a chance for the advertising students to see that the things they're learning to sell, dish soap or cars or whatever it might be, really can also be used to sell health. And then the public health folks on campus get some creative ideas from the exact students they're trying to reach. And so one particular semester, the health office asked us to focus on sort of a skin safety campaign. So, don't use tanning beds, do use sunscreen. And the students had 5 or 6 weeks to dig in and do their research and all the things they were going to do. And when it was time to start presenting their solutions to the campus health office, one of the teams got up, and this is how they described their target audience. And they said it's members of sororities on the UT Austin campus who are 18 to 22 years old who use tanning beds. This team really wanted to make a difference with this particular group. And this was a good answer based on their research and their understanding of the problem and where they thought communication can make a difference. So this wasn't a bad answer, but the team that went right after them used the persona that I'd been sort of coaching the students to start using. And they described their target audience as Rachel, who is this member of Chi Omega. They show where she shops. They explain that she's a health queen and she goes to a dermatologist and she's aware of the risk of UV tanning, but she believes it makes her look thinner and have better complexion. And so this team then used this persona of Rachel, who's an imaginary student, but sort of a composite of their research and understanding of their target audience, to help them think about messages that might convince Rachel not to use a tanning bed. And it's a lot easier to think through that as a one-on-one conversation in some ways than it is if you're aiming at sort of this faceless blob of 18 to 22-year-olds on the left. And so for every project we think about kind of what's a persona or a couple personas that can really represent our target audience that can help us think through a a communication and messages that would work on them. And then it will work on lots of people who are a lot like, in this case, Rachel. Another tool that we use in our work, it's called the single most important thing. And every ad agency has a different name for this, but it's all generally the same idea. And it's, if you are going to try to build, kind of focus your communication campaign and get the key message down to a single sentence, it's going to force you to be really focused and know what you're trying to say. And then that single most important thing, or that single sentence, sort of guides the development of all of your campaign materials. And I put up here the Verizon logo, because if anyone on the call remembers the old Verizon "Can You Hear Me Now" campaign, and so it was the guy just sort of wandering the country asking, "Can you hear me now?" every couple steps. And I had the chance to meet with the creative team that built that campaign. And they shared with me that it was actually just a single word that guided that entire like multi-year campaign. And if I ask you to think for a second, what was that word? The kinds of answers that people tend to, like the words that tend to come to mind that people usually are thinking about, are words like connection and fast and reliable. Like what you want to do is you're trying to pick a word that describes a good cell phone network. And the word that actually guided the campaign was relentless, because what they really wanted that campaign to communicate was Verizon is working the hardest to make their network the fastest, the most reliable, the best coverage, all those things. And so it was this attitudinal thing that was meant to describe Verizon's approach to building their network, that they knew would get more people to want to sign up for Verizon as their cell phone provider, but then also be more forgiving, because at the time the cell phone networks weren't nearly as good as they are now, to be a little more forgiving if they had a dropped call or there was a particular area that didn't have great coverage, because in that case, at least Verizon was working harder to solve those problems than AT&T and Sprint and T-Mobile. And so every single campaign material and ad they built and designed, they put it through that filter of, does this communicate relentless in the way we want it to? And it helped that entire campaign have a lot of focus and be really effective. Okay, so those are a couple of the sort of the tools and techniques we use in our work a lot that I kind of are very useful across a whole range of health issues. And so I wanted to offer those just as some of the examples of some kind of tools that you can take away from this talk to incorporate into your own work, hopefully. The case that I want to talk you through before we hit kind of a Q&A part of the webinar here is related to alcohol and sexual consent. And so it was a little over 3 years ago now that the University of Texas system approached our center about building a communication campaign that could be used across all of the UT system academic campuses to help students more effectively kind of understand and communicate about the intersection of alcohol and sexual consent. And if you think about those two efforts, I'm assuming it's like this on all of your campuses too. All of the UT system academic campuses do high-risk drinking prevention work. They all also do sexual assault prevention kind of work and campaigns, but those two things almost never exist in the same communication effort, because it's really, really hard to do it in a way that doesn't come across like you're blaming a victim. Like it's very complicated. And so the people doing the work on purpose tend to separate the issues, even though in students' realities and lives on campus, like they're pretty tightly linked in lots of ways. And so they asked if we could develop this, and the best clients give us time to do more research. And in this case, the whole first year of the project was only about doing research. And so, which was a real privilege and really helpful for an issue as complicated as this. And so we were able to do research both on the UT Austin campus, but also at UT El Paso, as kind of a partner campus that was different on a lot of ways. And so it's a smaller campus. And so we wouldn't build something that would only work on one campus. We could build something that worked for all the campuses. And one of the things that we did is we looked how other people were doing this, and no one was really doing this exact kind of communication campaign idea. But we were able to do a lot of interviews and surveys and things to start uncovering things that could be helpful in our work. And one of the most helpful bits of our research was that our team created what we called internally our drunk scale. And I'm going to put it up here on screen, and imagine it stacked up really like on top of each other. I have to split it across to make it fit on a PowerPoint slide. But what we did was we took sort of the BAC chart that you might be used to seeing and took all the numbers off it. And instead of, number of drinks or, 0.00, 0.02, all the things, we were working with undergrads on campus and we asked them to name each level of that scale. And so it goes from totally sober all the way down to blacked out. And then the second column is where we're explaining kind of physiologically what's happening. And then on the third the third column there, we ask the students to describe in their own words, what does it look like to be tipsy? And being tipsy means you get up to go to the bathroom for the first time, you got to catch yourself a little bit, but no worries, you got it. And so what we did then on a survey is we actually asked students on both campuses to pick where they thought you could be or where someone could be on this scale and still give or get sexual consent. So I want to give you all a second to look at these and just have an answer in your head of where you think that was. And now I'll show you the slides. And so please don't get too tied up with all of the numbers. The real takeaway, and sort of, if I was talking a few minutes ago about sort of what are insights where communication can make a difference, this is one of those spots. If the key takeaway from this set of data is that the young male identified participants in our survey data were exactly 1 drink higher on average, give or take, than the young female identified participants in our survey. And so there was this mismatch between young men and young women on campus in terms of where they thought you could be on the scale and still give or get consent. And so when we start thinking about where's a spot where communication can make a difference, making everyone aware of that mismatch was a thing we knew we would want to do. And so what I want to show you next now is a bunch of different concepts we built to play off different ideas and insights from our data and interviews that we thought might have promise. It's a really common step in our work to build way too many concepts and then use them as, we're going to work through them, make them better, pre-test them, and you have to always be willing to sort of follow your data is a real kind of key tenet of this kind of work. And so the first concept here, the students working on it were really interested and focused on, we were doing this first round of concept testing and development sort of around the time of the Justice Kavanaugh confirmation hearings. And so it was really intense. And one of the things that the students working on the project were really pretty interested and focused on was making sure that they could put a face and let all students see that we're not pre-blaming anyone, but letting them know that this is relevant for everyone on campus. So people would be willing to sort of hear the message and then engage with it and not immediately kind of, push it off the side. And so that was one idea. We, in our interview or in the survey data, we asked students to explain how they could tell if someone could give consent or not, or if someone couldn't. And so we took words that they used, like someone's disoriented, or you can look at their eyes and they're glazed over, all those kinds of things, and started to think about, could we use students' own words and language for how they make that decision, how they think about it, to be able to kind of put those same exact words back into the campaign. If that's how they're thinking about it, can we help them understand that? And so this idea of, looking at people's behavior, how they're talking or unable to talk or follow a conversation, and eyes. So it's like its own special category of being able to look in someone's eyes and tell. We heard a lot in a lot of different phases of the data collection, the interviews in particular, about how this felt like a very two-sided conversation and an understanding that it's complicated and people might not be on the same page. And so we had 2 different versions of this sort of two-sided story idea. The one on the bottom was designed to make it almost look like you're a little intoxicated while you're reading it. And these were just meant to capture that two-sided piece and helping people understand, like, it's a tricky conversation, but if it's not clear, it's not consent. You can see as one of the taglines that we were playing with there at the bottom. This idea, which we knew at the time when it was kind of this blue-pink, we knew that blue-pink wasn't the answer, and the bathroom stall icons wasn't the people, because that wasn't going to be nearly as inclusive as we'd want it to be. But our survey data, like, this was the insight that was tied directly to that survey data as sort of a first way of thinking through what that might look like. And so "You're drunk" is "Her totally wasted." was meant to hit on that idea of kind of the drunk scale differences that we were seeing. We, in another bit of our survey, we weren't sure if having this conversation would be perceived as building trust or might be viewed as like concerning. Like, why does this person want to talk to me about this? Like, has this person done something bad before? Like, it was, we didn't know for sure how students would interpret it. But our data overwhelmingly showed that students viewed this as a trust building conversation if you had it, because your potential partner is recognizing that these issues are linked and really important to talk through. And so this was an idea built on that idea of like, this is a trust building conversation, and making sure students knew that that's how it would be perceived was an important bit. And the last one I'll show you here, I had some advertising students that were doing this exact project in one of my advertising campaigns classes. And so they'll take, a 1 month shot at something that our center is working on for years. And it's a chance for them to kind of inform work that will really happen on campus. And it's a chance for us to tap into and understand the creativity of the students themselves. And one of the things that a lot of the student teams were coming up with was highlighting how intense and heavy a lot of these campaigns were, and trying to figure out if there was a way to make it a little bit lighter. And so they had this idea of using sort of emojis as a way to make the campaign a little bit lighter and more accessible. In some early pre-testing of this one, this was, to be clear, like this was student generated exactly. As soon as you put the UT Austin logo on it on the bottom right, which we did for testing, because we wanted to test who should the message come from, this campaign, even though it is student driven, and I know that, as soon as you put this in front of other students with the UT logo on, they immediately perceive it to be some old person at the university trying to seem young and hip. And so the way that logo changes the way students receive that message was really important to understand, and just didn't test very well, and it was perceived as too light and not right. So we, through a lot of work with students and the key stakeholders on both campuses, we started making these concepts better and getting rid of the ones that weren't going to work. And so this campaign remains pretty much unchanged. This one also stays and is pretty much unchanged. We built this as another version of that, the light idea, trying to come up with something that would be a little bit lighter. And this one had a lot of really ridiculous conversations, as if we're trying to help students understand that talking and thinking about alcohol and sexual consent are related. One of the creative concepts and ideas was like, well, this is a classic pair. So what other classic pairs are there? And so peanut butter and jelly was one, but then we had these conversations with like important UT administrators who were like, well, why is that jelly concussed? And, why is that donut chasing that little kid donut hole? And so this one wasn't quite right yet there, but it was easily the most fun one to work on. Like, we immediately were imagining how students on campus might have these little things and attach them to their backpacks, like they do a lot of other things on campus. And so it was the most kind of creatively fun one to work on that got some pretty positive reactions in some early conversations we were having. You can see here, this is the next iteration of that kind of blue-pink bathroom stall icon idea. But here we degender the icons, and we end up calling these little peg people. And also, you can see now it goes from "you're buzzed" is "they're totally drunk." And one of the things that came when we made this shift, which wasn't intentional but was a great benefit, is a lot of our thinking and early work and testing had really been thinking and focused on potential sexual partners. As soon as we made this shift, which we did to make it more sort of gender inclusive, students themselves then were like, oh, I could talk to my friends about this. I could talk to my roommates. This is a before we go out conversation. This is to check in the next morning. And it just created a lot of additional ways of thinking about the way we could improve communication on a complicated issue. And that wasn't intentional. It just sort of happened as a result of the design, but it was really beneficial for the project. And then we added another concept that, because as we continued to go along in our research, students themselves were like, can you just tell us like the right words? Are there magic words we should all memorize? Like, they really wanted like really concrete tips and advice and words to say. And so we started thinking about, these could be imagined as like beer coasters, like front and back, but sort of this Q&A card idea where we could kind of do communication skill building, because that was a thing we were hearing a lot from our participants that they were interested in. So I'll show you one more round of polish that we put on these. and then where we ended up. So this stays the same. This, we, made the jelly look not concussed anymore and added the little red solo cups so we could more clearly make the link and connection between this being about alcohol and sexual consent, because people weren't getting the alcohol part, but the little red solo cups helped a lot. And this one, for the same reason, instead of having two-tone, just like two tones within like the little purple person, a little teal person, we actually used beer as a visual to show those different levels. And we kept this one the same. So I'll give you a moment to look at those and think about which one you imagine tested the best. And I'll share our findings here. So when we test, and this was surveys again, both at UT Austin and UT El Paso. And so you can see here, the two-sided conversation idea was more popular at UTEP than UT Austin. And at UTEP, students were randomly shown 2 of the 4 concepts. And so we can experimentally look at the data and see like people who in this case saw this particular concept at UTEP expressed then higher intentions to communicate about alcohol and sexual consent with the potential partner. So that was an encouraging finding because that's one of the things we really wanted to achieve with the campaign. So that's a pretty important dependent variable that we want to be aiming for, and seeing that this one had that effect was exciting and encouraging. This one was a pretty remarkable finding. The students who saw this concept, when we asked them that same question, where can you be on the drunk scale, and give or get consent, they moved like an entire drink down on the scale. And so this campaign was clearly doing some work on thinking about like where you could be on that scale. And if you told me, 18 months before we did this part of the project, that we would develop anything that would move students in that way, we would have happily accepted that as an outcome and a finding in some of our early pretesting. And some open-ended items, students kind of like, what is this campaign about, was one of the questions we asked. Kind of open-ended items were much more likely to focus only on the alcohol piece and not necessarily catch as much of the sexual consent kind of piece of the campaign. And we really wanted to make sure this was balanced and showing how those two things are related. So that wasn't quite as great about this one. This tests terribly. Again, one of the scale items we used was related to tone. And so we asked students, what's the right tone for a campaign that's really designed to be at the intersection of alcohol and sexual consent? And then what is the tone of this campaign? And so all of the other ones are pretty much right on target. And this one just tests as way too light. And so we knew that this wasn't going to be the right answer, because we didn't want anyone to see this sort of in the real world and feel like UT system or the schools themselves who are eventually using these materials aren't taking the problem seriously. And so the tone just wasn't quite right, even though we went this direction because we were following insights and ideas from students. It was really, really hard. Like we never figured out a way to kind of execute on that lighter tone without it coming across as too light. And then the flashcard idea tests really well. And you can see here on the UT Austin campus, students who saw this had reported higher confidence in their ability to talk about these issues. UTEP students talked about having lower feelings of awkwardness. Both campuses, greater intentions to communicate. And so this one is doing a lot of the communication sort of efficacy intention work that we wanted the campaign to do. And so what this really means is that the right answer is basically to figure out, like we knew the right answer was to take the second and fourth concepts, like as you work from top to bottom, and find a way to put them together, because together those are doing a lot of the work that we want this overall campaign to do. So here you can see where we start landing with the action materials that are being released right now and pilot tested on social media. And so we take the little peg people, we do yet more work with the colors. I don't think I've ever done a project where we talked more about the colors than what colors these peg people should be. Almost every color that is either cool or warm is like our brains just process and apply gender to them. And also, we could never let it use oranges in a way that, even if it's not technically the burnt orange of UT Austin, anything even in that neck of the woods, other UT schools interpret as UT Austin burnt orange, and all of them have their own unique color palettes. And so trying to find colors that worked for all the campuses and were sort of made the most sense, given not wanting this to feel like a blue and pink campaign. And then you can see the little sort of the little Q&A communication skill building flip cards or coasters, like that idea becomes some of the things that can land in the thought bubbles above and the conversation bubbles with the little peg people. And so this is one page of a communication toolkit that we developed to give to all the campuses to be able to implement the campaign. And we included all different kinds. I mean, there's a lot of examples of what this might look like. And here you can see like what would it look like as a poster with this particular conversation. We mocked up what it would look like as A-frames on campus, just all the ways that we know on different campuses they tend to do this kind of outreach, giving them examples, showing what it might look like. And then as we're currently piloting this at UT Austin and UTEP on social media only, since no one's on campus. But the goal is to really release final materials to all of the UT system schools, so this can be running on campus as we head toward the fall, and hopefully a more return to sort of more in-person teaching if everything else goes the way I think we all hope it's going to go. So one of the reasons I always feel pretty confident and excited to share these kinds of tools and techniques in a talk like this is because it's the approach we follow on everything that we work on. And so on the top left there, you can see that was a hospital hand hygiene campaign that we had developed and then made freely available to anyone who wants it. We did this years ago, and then we're really trying to share it last March and April in the middle of COVID, and the Texas Department of State Health Services actually adopted it for all of their facilities. On the bottom left there, you can see we have a mobile app called Father's Playbook that's funded by the state to get expectant fathers engaged in prenatal health. It's sort of the expectant dad partner to the My Pregnancy Today app as a way to get dads involved, because that we know from lots of research, especially in developing countries, leads to healthier moms and babies and dads. And we don't do a great job with that in the US actually. And so thinking about ways that we can do that, again, like lots of research, evidence along the way. In the middle there, you can see a campaign we've been working on for 4 years now, promoting the Texas Prescription Monitoring Program to prescribers as a tool that's a part of the public health response to the opioid epidemic in Texas, and also can be a really important clinical decision-making tool. And so the work and thinking in that particular instance is, we never ever want anyone to see the messages we're putting out and think that opioids are bad, because opioids are the appropriate prescribing decision sometimes. And so a lot of work and a lot of thought into how to promote the PMP as a public health and clinical decision-making tool rather than as this law enforcement tool, which is the history of that kind of system and tool all across the country. And on the right there, you can see we also do tobacco control work for UT system. And so we do sort of work to help prevention, cessation, and policy work for all of the UT system schools. It's called the Eliminate Tobacco Use Initiative. It's led out of MD Anderson, and the work in Texas has gone well enough that it started to be replicated by different states and university and community college systems. And so again, thinking about the way communication can be a really important tool to support, in that case, a lot of really great policy work that can help people not start smoking or quit smoking if they're already a smoker, to help people on all those campuses. So my hope or goal was to go for about 40 minutes and leave some time for a Q&A and whatever a discussion might look like for you all. And so my contact information is here, because I could talk about health communication all day long, but I only have an hour with you all and wanted to leave some time for some Q&A. And so if we don't get to something you want to talk about, feel free to drop me an email. I'd be more than happy to keep talking, but I'll stop there and would welcome any questions or conversation you all want to have. Thanks for the opportunity to share with you today.
Thank you, Dr. Mackert. We will allow some time now for people to ask questions, so we'll wait a little bit. So go ahead and ask some questions, everyone. Okay, our first question is, do you have any resources for lesson plans for upper high school students?
Oh man, resource or lesson plans. Well, the first resource I would probably offer is if you Google NCI for National Cancer Institute's Pink Book. It's a free PDF that's available on the NCI website. The actual title of it is Making Health Communication Programs Work. It's a free resource. I use it in all my HealthCom classes. It's sort of a Bible of doing health communication work. And so if what you're looking for is a good, easy, free resource to kind of dig a little bit deeper and think about some of the processes and tools that I talked about really quickly here, the NCI Pink Book is a great place to start to learn yourself or to use as kind of curriculum or resource if you want to be teaching other people how to do this.
And that person said thank you.
Surely.
Any more questions, anyone? Where is that resource? Can that be linked as a message?
Oh, yeah, let me see if I can find it really quick here. Um, all right, I'll throw this in the chat window here.
Okay.
Oh, I think that might have gone. Let me make sure that goes to. I think it only went to the organizers and panelists, but we can help get that out, I'm sure.
Yes, I can send that out.
Cool.
We have another question. Just a moment. Where is your contact information? I'm not seeing it on the page that is presently visible. Oh,
Oh,
it's at the
uh,
bottom.
yeah, it's at the bottom. It's the macgrid at utexas.edu.
Okay. Feel like we should close this up now. So please keep an eye out for an email from GoToWebinar that will come about an hour after this program. The email will have a link for you to fill out an evaluation. This evaluation will help us for the planning of future events. We will get your certificate to you in 7 to 10 business days. Thank you everyone for coming. Thank you, Dr. Mackert, for presenting.
Thank you for having me. It was great to be here.
Everyone have a good day.